As you might guess from the title today, I'm joined by three exceptional women who fiercely deliver progress in our mission of transforming the world by ending avoidable blindness. Heidi Chase is the Seva Chief Program Officer. Heidi, can you wave your hand?
Hey, everyone.
Dr. Binita is our Country Director for Seva Foundation in Nepal. Can you wave your hand, Dr. Binita? And the talented and extraordinary Elizabeth Kishiki. She's an impassionate leader in eye care, and she covers the Africa region, and she's one of the first coordinators for childhood blindness and low vision on the continent for our partner, KCCO. Welcome, Elizabeth. All right, these extraordinary women really are live with me right now, even though you're going to be viewing this taped, but they're live with me today from Kigali, Rwanda in Africa at the 2023 Women Deliver Conference. And Women Deliver is one of the largest multi-sectoral convenings that is trying to advance gender equity. Over 6,000 people joined from across the globe this year to catalyze action for the rights and health of women and girls. And in this session, we're going to dive a little deeper into the trio's busy week, hear some highlights from the conference, what they learned, and their personal commitment to advancing gender equity through eye care, Seva, and beyond. So let me just take a moment by saying hi, and you guys have had a long day, so I wanted to thank you very much.
Thank you. It's great to be here.
All right, well, why don't we get it started? I think the first wonderment that I'm having is, what is some of your, and this is a question for each of you, this Women's Deliver Conference, what did you, from your different perches, what are in your different lenses that you might see the work and your personal backgrounds, and what are some of the key trends or learnings, or even new statistics that you came across that has you excited or energized about the work?
Who wants to go? Me. I will kick us off. So I was reflecting on this today. It was the end of a week, really, of incredible conversations with women and with men who are allies and committed to seeking out equity for women and girls everywhere. And this has been something that I've been working on my entire career. When I was in grad school, I wrote my thesis around women and girls in conflict settings, and have worked in violence against women, access to healthcare for women and girls, and now being able to work at Seva with that lens of eye care and really recognizing that women continue to be overlooked in this arena as well. Fewer women have access to quality eye care. Girls aren't able to get the care that they need. And so it was an exciting opportunity to talk with different people who are working at advancing equity in all areas, and noting that eye care has a really critical role to play in being able to help us achieve equity. So I think that was something that has been really motivating for me to be able to reconnect with organizations that are committed to this and layering in the importance of being able to see as a way of helping to advance equity around the world.
And I also, first of all, I'm very much thankful for Seva Foundation to help me come here to be part of this exciting group of women from around the globe. I have managed to attend so many sessions, plenary sessions, and in all the sessions, I have realized that we are having some commonalities in terms of the barriers that we are facing in dealing with the women and children. I'm referring back to my work that I've been doing for the past 16 years now. The statistics shows that women and children, especially the girl child, are accessing eye care services less compared to men and boys. So the same scenario is happening in all other sectors here, because we are with this consortium of groups of women from all over cadres like education, healthcare workers, the different NGOs. Both of them are speaking of the same barriers. So it was fascinating to learn that we are facing the same scenario, even because in some cases you might think that women deliver is more of political perspective, but it caters for all the sectors. So it was very good to learn from others the way they are taking these issues and the solutions they are proposing. And some of the solutions we are also implementing. So it was like brushing the way we are implementing them.
Yeah, I echo what Elizabeth just said. It was an incredible conference and very overwhelming for me, because there were women from around the world with various backgrounds. Equal importance, emphasis was given to health, to SRHR, to gender, to so many things about good governance and how to have women in leadership roles. But at the root of it all, the barriers were seen, just like Elizabeth said. And the encouraging part was that we were talking about the barriers and we were talking about the solution. The theme for this conference was share, solidarity, space, solidarity, and solutions. So the space was just right to speak out what was wrong, and the people actually came together, women and our allies, men, they came together for solutions. So it was not, like nobody was pointing fingers, but they were all working towards a solution. And from my background as a medical doctor, I saw that a lot of space was there for health, for global health, for women in health. And it was disheartening to see the statistics there that 70% of the global health force is built up by the females, but the access to healthcare is less than 50%. I'm talking about eye care, less than 50% for the females. So from that perspective, talking with the people who are working in the health aspect of this, talking with people who were working with community health workers, and talking with women who were in leadership positions, it was very encouraging because the problem was identified and the solution were being implemented or tried out, because the whole scenario is that we all have to be flexible. What worked yesterday is not working today, may not work tomorrow. I saw the aspect of flexibility in planning, in making new strategies, which was very interesting to me. And for me, the major takeaway from this conference is collaboration and partnership. That since the barriers are same, the gender who is lacking all the solutions, who is lagging behind is the same, and people who are working for him is the same group. So this is encouraging that people have come together. It is encouraging that people want to work for it. It is encouraging that the youth team, there was a big group of youth who are working for it. They are aware, the youth are being made aware of what is going on. So the future could be promising. And this looks good for us all.
You were saying, Dr. Binita, that the location was just right. And, I think that was really important because the conference was organized in Rwanda. And because of that, there were so many people from this part of the world who were able to come. And we know that eye care also, the unaddressed needs of eye care are largely in lower and middle income countries, and being able to have such a high representation from communities around Kigali and around Rwanda and in the global south was really critical, because I think we were able to really hear the voices of people who are doing this work day in and day out and talk about solutions.
Well,
And
let's talk.
there is one word that I do want to stress upon, and I love that word, and I'm going to use that word. It's co-creation.
Co-creation.
I really like that word. It's somehow reminded me of a baby and how we take care of a baby. That's a co-creation. So we should go ahead with that word, I think.
And going out with that word, because we are talking, the solutions that were given out mainly was collaboration and partnership. But the co-creation came in to remind us that the grassroots level need to be part and parcel of our work. They should be they should participate in designing the strategies. They should accept those strategies for them to be able to accept what we offer as a service provider, for example. So it was like my first time to hear the co-creation thing. So I was like, what are we going to create here? So it was like enhancing what we usually do, and for us to do it better, one of the solutions was like, we have to make sure that before we embrace our new strategies, we should start with the way we are doing our business. It shouldn't be like a business as usual. We should turn the lens back to us, see what we are doing as a gender sensitive institution, as a gender sensitive program. So by looking at ourselves, we'll be able to now embrace these new solutions, and they are in a position to be implemented. Yeah.
I can feel the excitement, and I think that as people are listening today, what I'd like to do is I'd like to kind of go back to some of the things that you've brought up so that we can help people that might not have relief and development as a background for themselves. Let's talk a little bit about, you talked about space, and I think in this case, it sounds like Rwanda, and I think we know about some of the recent history in Rwanda, and I think it's fair to say, right, that Rwanda is an extraordinary example for what's possible, especially in health. And I think what I'm curious about from your perspective is when let's talk a little bit about the barriers, and then we'll move to the solutions, right? So you talked about the barriers, both Elizabeth and Dr. Binita, you talked about the barriers are almost like a universal connector for all the different delegates that came to this conference. Take us a little bit more down into the specifics. What were some of the barriers that you heard that you realized, oh yeah, that's a similar barrier in Nepal or across Africa?
Most of the sessions, the barriers, the common barriers that were presented, women fail to access healthcare services because they can't afford the service centers are too far from them. Sometimes the decision making at family level hinder them not to access service at a time. We had stories from one family, a woman was about to deliver, but since the hospital was a bit far and the husband wasn't around, when the husband was called, he was like, wait, I'm coming. So those kind of barriers we are also facing in eye care services. We see the same things. Parents cannot afford to come for service. They can't afford for transport. They can't afford the services itself at the institutions. And some of the parents, even if like a mother has money for transportation, the husband has to say, yes, go. Mm-hmm. But if the husband doesn't allow that woman to go, it is obvious the woman won't access the service, or even if the woman wants to take the child to the service, she won't because the husband said no. So the same kind of barriers have been mentioned like the whole of these 3 days in the women deliver.
I'd also like to add how it was emphasized that there is very less women leadership. There's a barrier to women taking up the leadership position. There are less women in leadership position, in governance, and the discussions made it clear that it all boiled down to the community's outlook on how the women are perceived, and all the women over there, they're very clear about that they are not the weak sex. They are able to do everything that they're doing and do it better than men on a lot of cases. There were many examples over there, but there is a severe lack of women in leadership, and that is one of the major barriers, which is preventing the kind of care that the women want. So I believe that if I'm going to design a vision center, I'm going to talk about a vision center, which is going to be women friendly, which is going to attract females. So I will think from a woman's perspective. I will think about placing it in a place, in a location which is safe for her to travel. I'll think about having a clean, a toilet that she's able to use. I'll think about having a separate space where she can breastfeed. And I'll also think about having at least one in a country like Nepal, having one female worker within the center. So if the women are in a position to think for women, the kind of service delivery that a woman would want, then the service deliveries would be better, the access would be better, and we will be actually reaching where we need to reach. So that was one barrier. The leadership, the dearth of leadership, it stood out very strongly.
Yeah, I think that's unfortunately something, I've been very similar to Heidi, I'm older than Heidi, so I've been in this kind of relief and development work, and we did the Millennial Development Goals all those years ago, and some of these themes are that they just continue to be maybe opportunities for us as a community to show up differently, to design differently, to think differently. So what were some of the solutions? Well, before we get to solutions, can we go back and talk a little bit more? You both got really energized by the co-creation language. And I want you to kind of spend a little bit more time on that, because I think a lot of us listening are we can probably intuit what it is that you're talking about. But why don't you spend a little moment on what was that conversation like? Because it paints a very big picture. It's like the word love or compassion. But what does, co-creation is very special, and it sounds like it's almost a battle cry to people like yourselves. It's an invitation, right, to sort of think about the work differently, to hear about the work differently. But why don't you spend a few moments lingering on that and talk me through, like, where is that energy coming from, and what was being talked about as that word got introduced and sort of caught fire across the conference participants?
Well, co-creation, from what I gathered from all the discussions, is that the need for coming up from bottom up approach, where the women are actually there, the women who need care, the women who need to get up, go up in leadership position, go up in their career, they would be working on it. But they definitely need support from the government sector. That there should be legislations, there should be policies which are going to support what to fulfill that the women reach their ultimate potential. So one aspect of the co-creation would be the grassroots level and the government coming together. And needless to say, without having a strong policy to protect women's rights and to enhance their potential, we will only just be talking. We'll be able to do things, but only in very small, in bits and pieces. It will not be structured, and it will not become a movement. It will be there just in bits and pieces. The other aspect of co-creation is the collaboration, to connect the different aspects, connecting the sexual and reproductive health, connecting eye health care, connecting education, connecting livelihoods, all of tips revolving around the woman. If the different organizations working all of this in all different sectors coming together to create a holistic, a comprehensive kind of a package, a kind of a program that will speak to all the needs, that was another aspect. So the collaboration was a major topic here.
Yeah, and when they were talking about co-creation, it wasn't. It was not like the only the people who are in connection with the women at the grassroots level, but also the policymakers, the funders, because sometimes the funders would come with some restrictions that women cannot access those funds because maybe they don't have some policies in place, those difficult ways for the women down there. So the co-creation, it calls for all the parties to work together towards the same goal. If we want to give space to these women, we have to hear their stories first. It seems like many organizations were saying this, that we have created a group of women there in between. They are like the voice for the voiceless, and it has been made very clear that everybody has voice. Nobody is entitled to speak on behalf of someone else. It is only because we have created some barriers that the so-called voiceless cannot access the mic to say what they would love to. So the co-creation calls all of us, all the players, to come together and work towards a specific goal.
Yeah, I think there was a real recognition that, we can't have an idea or a solution ready made and then come in, but really giving that space for voices and stories to inform how we are thinking about programming and actually being able to get to that result. And I heard someone today talking about how they really needed donors and people who had funding to invest in programs to continue to just have that investment and not change their priorities like they're changing their clothes every day, right? And to really remain committed to the strategies that have been agreed upon that can really make a difference, right? And so I think for me, when I was hearing that, it was a reminder that our continued investment with the partners that we work with, having long-term relationships and that conversation with the partners about what is working, what might not be working, how can we make sure we're bringing voices from the communities that we're working with into those design conversations, and also having that consistency of we're going to continue to be committed to kids. We're going to continue to find ways to increase access, and not necessarily waking up tomorrow and saying, oh, now we're going to really be interested in dancing ballerinas.
And in co-creation, there was one more aspect. It was the intergenerational aspect where the two generations, like I said, there were 1,200 youth leaders in this conference, 1,200. And there was a platform where I would not say the elderly, the less younger generation and the younger generation, they came together and they pledged that they will work with each other. The less younger generation providing their experience, sharing the mistakes that they made so that the younger generation would not make, and the younger generation learning from them. So this is another example of the co-creation that was being talked about.
Yeah.
I think I was just reminded also about, I was meeting with one young youth leader, and she was so clear about what needed to happen and the changes that needed to take place and access to services and so many pieces. Like it's learning from older people, but also recognizing that a lot of younger people have solutions. They've been living this, and they are recognizing. We talked a lot about climate and the fact that changing environments within the climate and climate catastrophes are just going to continue to happen. And it's our young people and the youth who are really having to deal with this, because they're the ones who are going to be around having to try and manage and navigate. And so really recognizing that a lot of solutions are coming up from the youth as well is really exciting.
That's terrific. It's interesting because oh, go ahead.
I was just saying, the other thing that stood out to me when it was reminded kind of that like life cycle of care and that continuum of care. And we talk about continuum of care kind of from a, identifying a diagnosis, making sure that the child or the grandmother gets the eye care services, and then that continuing follow-up, but also recognizing that at different points in life, people have different eye care needs and different healthcare needs. And so really thinking through how to design, the vision centers in a way that will meet women and girls where they are, but also address their specific needs for eye care in different ways. So something that struck me.
Heidi, the continuum of care, that is one of the strong pillars for quality assured healthcare service. So that is something that we really must strive for.
Sorry, Kate, I had interrupted you.
No,
you guys say something else. We were all like, no, GC, I want to say something.
This is how women deliver, though. I mean, these kinds of opportunities, I think anybody that might be watching this in a future state, like this is when you're a practitioner, and from my work in the past and your current work, each of the three of you, these are very important moments for us professionally. One, they reaffirm what things that we know, but they also have to inspire us to do better and to do things a little bit differently. And it sounds like the conference was really successful on those fronts. And the phrase of co-creation, part of what's attractive about Seva Foundation is that I feel like this is one of the few organizations in the development or social justice space that never had a colonial paternalistic approach to the work, right? I think that the organization always had tremendous respect and continues to have tremendous respect for the integrity and the wisdom of communities, and making sure that our own, now I'm not saying we're perfect, because I think we have lots that we can do better and differently, but it sounds like that word co-creation is like this next level commitment, right? It's action based. So I think it might find its way into my vocabulary describing the work that we do. Heidi, maybe just take a brief moment, because now I'm curious. A couple of years ago, right before COVID, the two of us embarked on a landscape analysis for Africa and worked with a local organization. And my wondering is, let's briefly walk through for folks that might be watching, like, what was the landscape analysis? Like, what were we trying to do? And then quickly bring it to, like, did you find yourself as you were participating, stress testing some of the stories and the learnings that we gathered from that landscape? And how, let's be really, I'm going to be a little bit exposed as a manager to say, like, how relevant is that now that we're 4 years on COVID and everything else? So, yeah, I know it's a big question.
Yeah, so
we decided to tape your answer.
A couple of years ago, we wanted to take space and see, like, how are we engaging in the Africa region? How can we look at diversifying how we're working, who we're working with, as a way of having greater impact? And so we put out a call for a consultant who would be willing to take on this challenge. And we were able to work with a group that was based out of Kenya, but had consultants in a number of different countries across the region. And I think for Kate and I, that was really important, because it was people who are actually living in the communities where we wanted to understand a bit more about. And the purpose of the landscape was really to document the eye care needs, some of the emerging issues, assess who is engaged in eye care delivery across the, we focused on the countries where we're currently working. So we focused on Malawi, Tanzania, Uganda, Burundi, as a way of unpacking and understanding kind of the local context there, recognizing that, Africa as a continent has a lot of diversity across it, and not wanting to make too many generalizations. And then wanted to also understand some of the local organizations that were interested in eye care, where there might be some opportunities. And the landscape really confirmed that visual impairment remains an overlooked need for the communities in the Africa region. Countries generally lack access to eye health care. They also lack the professionals, right? There's a big need to develop the HR to provide eye care. And there's limited funding. And so governments and ministries of health, that are being pushed and stretched in different ways are not often able to prioritize eye care as an area of focus. And so despite that, the landscape also recognized that there are some opportunities, and there's definitely opportunities and solutions. One of those elements is that all of the governments around the world, including the governments here in the region, have committed to universal health care. And eye care is a critical part of achieving universal health care. And so we have an avenue to be able to work with governments to help them actually achieve what they said they wanted to achieve. And there's a lot of entrepreneurial opportunities, organizations that are interested in getting healthcare to communities that don't have them. And I think that we can start layering in eye care as well. And there's a real commitment to training. And even before Elizabeth and I came to Women Deliver here in Rwanda, we had a chance to spend some time together in Tanzania as well as in Malawi. And talk with eye care leaders and heads of hospitals about how to start to build out the HR capacity and kind of creative solutions for spreading that knowledge in greater ways. So, okay, I don't know if there's anything you want me to expand on. I kind of just talked because it was a bad question.
Yeah, it was. In fact, I'm just trying to tee it up because the bouncing ball is about to come back over to Elizabeth with some questions, and you, Dr. Binita. So I think what I'm hearing from you, Heidi, though, is that even though it was conducted several years ago and we all went through COVID, there's still a lot of relevance from that work. There's still a lot of information that we're learning. And I think coupled with, as we start to marry it with this experience that the three of you have had at this conference, my wondering is, how is this now? Because I'm always curious about, there's some woman out there who hasn't seen her kid, or some grandmother who isn't fully participating in her life because of a vision issue that we know we can help solve, right? The network that we're a part of. And the wondering, that brings the urgency about, how does all of this turn into something that's going to change someone's life? And I guess what I'm wondering about is, how do you see this conference, or is there aspects of what you're, either connections you've made or something that you've thought about or something that's been re-energized in you? How do you see this maybe influencing how you're going to go back and do your day job, next week when you wake up in the morning? Like, so Elizabeth, for you, you have a big job. You are a passionate advocate. My wondering is, and you've done this for a while, so what changes for you? Like, what do you think? This is your space right now to talk, like, between us girls, what is going to change for you when you wake up on next Tuesday morning and you're looking at your work, you're looking at your programmatic portfolio, what needs to change and what do we need to hear as your colleagues so that we can be better prepared to support you?
Thank you, Katie. My work is looking at women and children accessing eye care services within their reach. And we have been using the volunteers, the key informant, as volunteers to identify children with blinding eye diseases, and microfinancing groups. We have been using them as volunteers in identifying their fellow women and men with eye problems. And from the work that we have been doing, we have seen a lot of women accessing services and a lot of children being identified, some earlier, some a bit late, but at least they accessed the eye care services. And from this conference, I was moved with one example that were given by UNICEF. I think they came up with the example of what make them like looking. When they were talking about co-creation, they were like in the tea farming and tea leaves picking, and these women would go there with their kids, and they would just leave the kids on one line until she reached at the end and come back, so that child actually stays with the mother the whole day. So they came up with the idea of creating a center whereby the kids would stay there, get educated, get healthcare services while the mothers are still moving on with their work of picking tea leaves. So I thought maybe that kind of idea, back home we could try to pilot it somewhere, whereby sometimes we are having outreach, and many of the kids who are identified by the key informants wouldn't show up because they would say, today there is a market, all the mothers have gone to the market. So these kids whom we identified won't access this service because nobody would bring them here. So the idea could be like, instead of sticking on health centers, we could create a screening camp within the marketplace so that the mothers would just bring in their kids, the kids get services, and they continue with their business. So I thought that in that way, we could provide space for these women to continue with their work and space for the children to access services. Yeah.
I thank you for that example, Elizabeth, because that's the wondering I've had. You know, I gave birth to my daughter in Egypt, in Cairo, and came back to the States, and the wondering that I had was, for this to work for women, there has to be a practical element, but there also has to be shared. More than one thing has to happen in the space. You know, women are notoriously famous for our multitasking. And if you're lucky enough to have an education center, that can become the incubator or the holding space for lots of different activities for the benefit of that child or for the benefit of that family. So I've always wondered about the design and what communities we're going to do and how they might show up. So that's a really beautiful example, and I look forward to how this continues to sit with you, and as you start to co-create and work together with community members, where this idea might go. But I think that's a very special idea. Yeah. Dr. Binita, I think I would probably put the same question in front of you. Like, what's going to change after you get over your jet lag? What's going to change when you wake up in Nepal and I think I saw a bit of an insight to some of what I can already see how it's influencing in terms of you're questioning even the design of the Vision Center. Earlier in our conversation, you talked about space for women to breastfeed, space to have, laboratories, toilets that actually work for women. I think that's something a lot of folks listening in on this would be like, well, what does that mean? Well, it has to be thought about. So I can see some insights to how it's beginning to influence your analysis of what we're doing. Anything else come to mind in terms of what might change for you when you go back?
Yes, Kate, a couple of things. I'll start with very close to home. I'll start with the women I work with. I will have a conversation with them on how comfortable they are in our office. I will start from there, whether they have the kind of space that they want in the office, whether we are able to actually meet the needs of them as women, as mothers. That is going to be the starting point for me. And after that, I will have conversations with our implementing partners. Although we capture the number of women and girls that we reach to in our KPIs, we capture them as they come in. We have not had any kind of program design with the partners or any kind of discussion at all with the partners on how we can have the camps and even the walk-in patients involved in having more females coming into the hospital. Can we design a particular kind of program where we can target on the girls or on the females? How we can provide them with more access? That will be the second discussion that I'll start on. And I was also thinking about there was a lot of talk also about on mentoring, and I was thinking about all the female ophthalmologists, optometrists, ophthalmic assistants, administrators that we have trained with, that Seva has helped train. So we can have them together. We can maybe form an alumni of Seva trainees with our partners, with our implementing partners, and they can be mentoring the new intake in their hospitals, or they can help the other hospitals when someone comes in to how to go about it, how to get work the best way that you can, share their experience and share the knowledge. So these are three things which have been going around in my head. So I will be starting with those first. And yes, one more thing is, I'm sorry, I keep it. No. Another thing is we have to include some young people, mostly in our outreach camps, and whenever we're going to schools, because in one of the sessions today, it was so clearly mentioned that if a young person wants to go to an elderly person for some sort of support, sometimes that generation gap works against the young person. And the young people like to listen to someone they're closer to their age group. So we should also start working with the young people, mostly in the outreach and in counseling portion. That is going to be very important.
Yeah, but to peer mentorship, and this we discussed with Heidi when we were in Malawi. As KCCO is usually running the post-session cross-learning session with the programs, these cross-learning programs usually do not include the periodic programs. So from this perspective, I think when I go back, I would go with the idea that I got that we could, if we can't gather them together because they are from different countries, we could prepare a forum, like an online forum, for them to discuss their work together. Because we're having like 3 or 4, actually, all of them. All of them. They can just be online and discuss their work and their challenges and how they can help each other. And if possible, like on-site visit for some of them. Yeah.
Yeah, we talked, a lot about the importance of mentorship and it really investing in leaders. And Seva's had the opportunity to work with Orbis and with women in ophthalmology on the Women Leaders in Eye Health Forum, which brings women together virtually from all over the world. And Dr. Binita, I love the idea of being able to have that little microcosm of people in eye health working together and women coming together to support one another. There's a t-shirt that I've seen running around this conference that says, as strong as the woman next to me, right? And really recognizing that we, as a group of women, and as leaders, each of us as a leader in our own right are only going to be as strong as the other women that are near us and next to us that we're bringing along with us. And so I think, one of the things that I'll be thinking about is also how do we grow not only just the HR pipeline for eye care in general, which is such an important need, but really recognizing the value of women leadership and women voice in the decisions and the design of the work that we're doing.
I think that's a really wonderful way to maybe begin to wrap up this conversation, and I'll get t-shirts made for all of us. I think if that's true, then I think right now this is a very strong group of practitioners and committed activists that we have working on this issue. Is there anything else that we need to say before we say goodbye? Because I know it's late for you and you probably want to go out and do some other things to relax or decompress after a long conference. So before we say goodbye, is there any parting thoughts or messages or something that you feel, we never talked about it and you feel like we might should have done so?
When I was listening to the landscape analysis that was conducted in 2021, I'm curious to know whether did it manage to capture the gender gap that exists within these programs?
Yeah, gender was definitely a part of what it highlighted in terms of the discrepancies and also the potential opportunities. Yeah.
Okay, I think we have a tired group here. So I think what I heard, Elizabeth, you asked the question about what did the landscape analysis reveal, and you were really articulate. You went straight in and said, did it talk about the gender gap? And I think Heidi's answer to that was, yeah, it did. It highlighted gender. Unfortunately, I think that any of us working in this space over the past couple of decades, it seems to be a thing that everybody notices, but we don't really get real traction on it. And I think what you talked about at this conference is a dimension to that. Like, where are women in terms of what are they working on, but where are they in terms of the decision makers, right? And at Seva, what we're fortunate to have at the foundation is women up and down the management chain. So there's a lot of female perspective, in addition to the wonderful male allies that are also joining us in this work. But when it comes to the country, the macro environments, that's not always the case. It's a challenge. And it inspires me to think that there's probably a little girl out there in one of your school programs or visiting one of your vision centers who might see that mid-level ophthalmologist who looks like her, and it makes her think about a different career for herself or a different life for herself. So I do think there's something very special about the work that you're currently doing. And we just don't know what future head of state we just gave a new pair of glasses to, and who's going to finally see the chalkboard or be able to read the book better so that she can unlock her potential. I think with that, is there anything else that you want to share before we say goodbye? Because I keep offering to say goodbye, but I could talk to you guys all night.
I just wanted to highlight on the policy issues that we have been doing at our levels, but I think it is also imperative for all the players to also try to push some of the I don't know to call it, is it changes or the improvement in our settings, like if we could do advocacy at national level so that they can change some of their system. For example, the referral system, a simple example. The referral system do not favor children, especially children with eye cases that need to go at tertiary facility. So it's like the child would go around to all the steps because it is the system. So if we could invest on advocacy for change on that specific area, that for case of, we are talking of eye care services, we don't know about maternal health, they could speak of themselves, but at least for eye care services, some of the systems need to be altered to fit and help a child access services as soon as possible. And all this need to like a combined effort to advocate for change.
I think one of the things that, I completely agree, Elizabeth. And one of the things that was happening at this conference was a concerted effort to get this input and these voices from all of the delegates to inform the high-level consultation that's going to be happening in September at the United Nations around universal health coverage, right? And so Seva is going to be in New York as well. Kate's going to be representing us along with the International Agency for the Prevention of Blindness as a way of really starting to lift up these issues around universal health coverage and how we need to make sure that that coverage is including eye care, that it's representing women and girls and communities that are overlooked as a way of actually being able to achieve what governments have committed to doing.
It's a good one.
Mm-hmm. Good to know that Kate will be there to speak for all of us.
Mm-hmm.
No pressure, Kate.
Well, I think before I go, I'll be in touch with each of you and some others. I really loved how you framed it, Dr. Binita, that, listening to one another. And I think that our strategy as an organization is to work through IAPB as a membership group, because advocacy, each group can go out and try and do it on their own, but we're going to be better if we can take the collective power of our implementation. Like, we stay focused on helping that woman, helping that girl, helping that son or that grandfather get the sight that they deserve. And then we're savvy enough, hopefully, to be able to give data and information that can influence the kind of policy, Elizabeth, that you're talking about. How do we help make our representatives at IAPB or at the United Nations understand that there's an opportunity as they're brokering major deals with these countries to have the dialogue? The co-creation can also come through our expression as implementing organizations, right? So the co-creation can kind of take and it should take lots of different forms and shapes as we try and change systems that are not changing fast enough, frankly. They're just not. And we'll see where September goes. But I can foresee needing to talk to you again, so that when I'm there, that I'm as clear and as articulate as possible about our point of view, and to try and help make some of the changes at this macro level so that they can help influence the change in the direction that's happening in the communities. Yeah.
Thank you, Kate.
No, thank you. It's a pleasure. I joked about this earlier, but I feel like when I come into these conversations, I have so many people. I have your heads, your brains, your personalities, your voices are right there with me. And I just do the best all of us are just doing the best we can to channel that in the moment, and then hope that it begins to inspire us to we don't need more, we need better. That has been a mantra of mine since the 1990s when I was working in the Balkans. It's like, we don't necessarily, the money is there. We need it to be better thought about, better executed. Just there needs to be a better way of doing it. Great. All right. Well, listen, you guys have earned an evening. Thank you so much for making time for this. I'm very appreciative. It's so great to see you. Elizabeth, we got to get you back to Berkeley. I think it's been 5 years. I think I saw you 5 or 6 years ago. So I need to, yeah. So we need to bring you home. And Binita, I think I had a chance to see you in January, but I know we'll be seeing you in November. And Heidi, I'll look forward to seeing you as well. So be safe, enjoy yourselves, and keep this conversation going. And Heidi, let's look for space where we can kind of come back in a few months and really revisit some of the things that are inspiring you today. And I'd love to hear more about how are you trying to execute against some of these beautiful big ideas, and do you have the right resources, and do we have the right systems, and are we doing things in a way that can really move things along in a positive way for women and girls? Okay, now go out and have something cool to drink.